Good afternoon, and welcome to our webinar for, I think it's Tuesday, June 23rd. We're just going to get all of this stuff up and running because I think it's 1 o'clock and we can get started. So, as always, Tuesdays and Thursdays are Walk and Talk with Rob. Today's Tuesday, so that's what we'll be doing. This is me. I am your host. My name is Rob, Cardiac Rehab Supervisor here at UHN's Toronto Rehab Cardiovascular Prevention and Rehabilitation Program. So we're going to do a 30-minute exercise session that consists of a light warm-up, a little bit of cardio, about 15 minutes or so, a couple of resistance training, some muscle strengthening exercises, and then we'll do cool down, stretching, and then we'll be done around 30 minutes or so. So just a couple of things to remember that while this program is fairly low intensity and I really think anybody should be able to participate, it's at least a good idea to make sure that you're medically well enough to participate. So if you're in a cardiac rehab program, that's great. If you are not, just make sure that your doctor is okay with you participating in the program. Everybody knows we should be looking to exercise at least 5 days per week. I only do this twice per week, so hopefully you're doing something for those other 3 days. If you enjoy following along on the videos, do realize that we record these and they're posted on our website, cardiaccollege.ca. So if you want to watch one of the recorded versions, you can do that anytime you like. The exercises might make you breathe a little bit harder. You might feel a little bit of fatigue in your legs, but by no means should any of this cause any kind of pain or discomfort. If you do develop any kind of pain or discomfort or any unusual feelings, please stop the exercise. Hopefully the pain goes away. If the pain does not go away, please reach out to EMS as needed. So for today, hopefully everybody is feeling well. You've got no symptoms, so no chest pain, shortness of breath, dizziness, palpitations, nothing out of the ordinary for you. Hopefully you've taken all of your medications, and for those of you that are living with diabetes, your blood sugars are at a safe level for exercise. I think that's all our usual disclaimers, so let me stop the share. There we go. I'm nice and big up there. 27 people so far online. And let's get started. Okay, so as always, we want to start off by getting a resting heart rate. So if you can find your pulse here in your wrist or up in here in your neck, that would be great. And I will give everybody a 10-second pulse check, starting in 3, 2, 1, now. And stop. Okay, so that was our 10-second pulse check. Hopefully, if you've been following along for a while, you're getting a good feel for what your normal resting value is. That value can range an awful lot, anywhere from 10 to 16 beats in a 10-second count. And even for some of our cardiac patients who are on medications designed to slow your heart rate down, getting down to 9 or 8 or even 7 is not out of the ordinary. So hopefully you've got your regular normal value. All right, so before we do our exercise, we always start off with our dynamic warm-up. It's the 4 exercises. So let's get started with those. We'll start off with a little bit of marching. Our exercise is going to be using our legs today, so we want to make sure we warm our legs up. And these are also the biggest muscle groups in the body, so that will also start to get our heart rate moving up a little bit as well. And if you're feeling particularly adventurous and bold, you can add your arms into the marching as well. A little variety today. Okay, so that's our marching. Next thing we're going to do is we're going to loosen up our hips. So hold on to something big and solid that's not going to move on you. I'm going to use the fridge. And then just swing your leg back and forth. Slow, deliberate movements is what we're looking to do. Not too aggressive, not too fast. Just looking to loosen that hip joint up. Okay, and then let's switch to the other leg. And even though I'm looking over my shoulder, everybody at home following along should be looking forwards. Okay, so that's good. Our hips are loosened up. Next thing we'll do is we'll loosen up our ankles. So just lean against something so you got some good balance. And then you're trying to make big circles with your toe. Once again, slow and deliberate. Just trying to loosen things up and get them ready for our exercise. Make sure you get both directions. And then let's switch feet. And switch directions. And let's finish off with some shoulder circles. Loosen up those shoulders, back of the neck, upper back. And make sure you get both directions. Okay, and now let's start with our aerobic warm-up. So just a little bit of light walking at a pace a little bit slower than you would normally exercise at. And once again, this just gets our blood flow optimized in our body. We want to try and make sure that the blood is directed where it's needed. In this case, it'll be the working muscles of the legs mostly, and to the heart. We'll constrict some of the blood supply to our gut. The extra blood needs to come from somewhere. Typically, we'll take it from our gut when we exercise. We'll do this for about 4 or 5 minutes or so, just to get going. So I think everybody knows that these sessions are called Walk and Talk with Rob. And what I try and do is I try and answer questions during the cardio, during the, I guess, the talk part of the exercise. Just helps pass the time and those kind of things. Didn't have really any questions for me to address today. So I think what I'm going to do is I'm just going to talk a little bit about blood pressure. Talk about what it is, how it's measured, what normal values are. One of the more common questions I get about blood pressure is what's too low of blood pressure? What numbers are bad when it's low? So we'll talk a little bit about that as well. And then once again, if you guys have at home any questions or anything you'd like me to talk about, at the end of the session, just kind of put that in the chat or the Q&A feature of this Zoom cast. And I'll do my best to talk about it next time we do this on Thursday. Or if I get a lot of questions, next Tuesday. It's a nice dreary day out there. We're very fortunate. The north wall of my kitchen is floor to floor, wall to wall windows. And I'm looking outside, it's very wet and rainy and dreary out there today. Good day to be exercising indoors. Okay, we'll warm up for about another minute or so, and then for those of you that would like to, you can increase your pace. Start doing a little bit of cardio. I'm wearing my new watch. It tells me when I've been exercising. I like it. It gives me a little buzz saying, hey, that's great, Rob. Keep up the exercise. Likewise, when I'm sitting at my desk for too long, it also gives me a little buzz saying, hey, Rob, you've been sitting for far too long. Get up and move. This is one of the newest risk factors that we've been taking a look at for coronary artery disease. That's sedentary behavior. It's basically sitting around too long. We know that if you spend too much time sitting, it's associated with negative outcomes in terms of your cardiac health. So ideally, you'd like to get up, at least once or twice every hour, not to do much, You just stand up. My watch tells me to do a torso twist 5 times. That's all you got to do. Just got to get some metabolism moving a little bit more, and you can offset some of that risk, a lot of that risk of too much sedentary behavior. Okay, so that's our warm-up. So for those of you at home, if you'd like to pick up the pace, feel free. When I do my talking, I like to use my hands, so I can't do this, but if you want to include some upper body work into your marching, that'll make the exercise a little bit harder, so feel free. Something like this. Something else that you can add to your exercise. I was also talking to a colleague of mine who's been following along at home. Diane, if you're there, hello, Diane. And she was saying that just marching on the spot is getting painfully boring for her. She likes the exercise, but she wishes I could mix it up. So one of the things that we can do is you can also just kind of march to the side a little bit. You can try a little bit of this. Anything that uses muscles will get you going. And if you're at home and balance is a little bit of an issue, you can do this holding on to a chair just to help a little bit, or you can do it at a counter. I'm going to stick with marching though. I like marching. Okay, so I thought I'd spend a little bit of time talking about a risk factor that often doesn't seem to be managed very, very well, and that is blood pressure. So what is blood pressure? Well, blood pressure is the pressure in your arteries that's generated when your heart contracts or relaxes. And typically when people talk about blood pressure, they always throw out numbers. And you'll hear people say, oh, your blood pressure should be 120/80. Well, what exactly does that mean? What are those numbers? Well, those numbers are the pressures in your arteries at different phases of your heart's work. So the top number is what we call your systolic blood pressure. And that's the pressure in your arteries when your heart's contracting. So when your heart contracts and squeezes and it pushes all that oxygen-rich blood out through your aorta and eventually through all the blood vessels in your body, what kind of pressure is generated? So the systolic blood pressure is the top number, and that's the pressure in your arteries when your heart's contracting. The bottom number is called the diastolic blood pressure. That's the pressure in your arteries when your heart's relaxing, when it's filling. And it's going to be lower. Makes sense, right? When you're squeezing, you're going to generate more pressure than when you're relaxing. So that's what the two numbers are. And typically when we measure blood pressure, we'll get this sphygmometer, the blood pressure cuff, sphygmometer. It's basically a deflated balloon. What we do is we wrap this most commonly around the arm, and then we'll start pumping the balloon up. And as we pump up the balloon, we're putting more and more pressure on the arm. And in particular, we're putting more pressure through one of the arteries in your arm, the brachial artery. And we'll put our stethoscopes on and we'll listen to the blood flow in your brachial artery. And eventually, if I put enough air in that blood pressure cuff, I can squeeze your arm enough that I can cut off the flow of blood through that brachial artery. And I can hear that. When I got my stethoscope on and I'm listening, I don't hear the blood flow anymore. And then what I'll do is I'll slowly start letting the pressure out of the blood pressure cuff. And the pressure will come lower and lower and lower, until eventually the pressure will get low enough that when your heart squeezes, it can just manage to squeeze blood past that restricting cuff. And I can hear when that happens. So we'll put the cuff on, inflate the bag pretty high, cut off the flow of blood through that one artery, and then I'll listen and I'll hear there's no blood flow. And then I start letting the pressure come out of that blood pressure cuff until I can start to hear the blood squeezing by, but only when it contracts. I'll make a note on my blood pressure cuff of the pressure at which that occurs. And that's your first number in your blood pressure, the systolic blood pressure. Then what I'll do is I'll continue to let the air out of the bag, out of the blood pressure cuff, until eventually the pressure is low enough that it's not restricting the flow of blood at all. And once again, I can hear when that happens through my stethoscope. I'll make a note of the pressure at which that occurs, and that's the bottom pressure number, which is your diastolic blood pressure. So systolic is the top, diastolic is the bottom, and that's why we use the blood pressure cuff, or how we use a blood pressure cuff to pick up the pressures. This is the most common place to get your blood pressure on your arm. A lot of the time, your doctor will check both arms because we're not built perfectly symmetrical. Some people, the left side of their body is a little bit different than the right. So we like to get the pressures on both arms. You can get your pressures checked in your legs as well. They'll do this sometimes to check for something called peripheral vascular disease. Pretty much anywhere where you can wrap a cuff around and increase the pressure enough to cut off the flow of blood, you can use that to get a blood pressure. I don't know if you'd want to do it around your neck. Probably not a good idea. Definitely not a good idea. Okay, so that's how you get the numbers. That's what the numbers mean. Why is blood pressure a problem? Well, we've said in prior sessions that your heart beats about 100,000 times every day. That's a lot of heartbeats, right? Millions, millions, millions over a lifetime. If you've got a really low and well-controlled blood pressure, when your heart contracts and squeezes blood out through the aorta and into the coronary arteries, the pressure on every one of those heartbeats is not going to be super, super strong. But if you've got high blood pressure, every one of those heartbeats, 100,000 times a day, you can start to do some damage to the linings of the coronary arteries. And once you damage the lining of a coronary artery, you're kind of laying the groundwork for the development of coronary artery disease. Likewise in the brain, right? We know that high blood pressure is the number one predictor or number one contributor to having strokes, right? We know the brain is very, very fragile, so we got to make sure the pressure up there is not high. So we got to control it. So generally speaking, the cutoff that we have for what's an acceptable blood pressure is 140 for the top number, no higher than that. And for the bottom number, no higher than 90. If you're above 140 or above 90, congratulations, you can have a diagnosis of hypertension. Hypertension occurs, you can have mild, moderate, or severe hypertension. It's basically 20-point blocks. So 140 to 160 is kind of mild, 160 to 180 is moderate, 180 plus is severe. For the diastolic numbers, it's 10 points. So it should be no higher than 90. 90 to 100 is mild, 100 to 110 is moderate, 110 plus is severe. Okay. Your blood pressure also varies an awful lot throughout the day. So if I check your blood pressure once and it's high, I'm not going to say you've got hypertensive heart disease. You want to make sure you check it multiple times over multiple visits. Because if you've had a bad night's sleep, your blood pressure will be a little high. If you're in a bad mood, if you got stuck in traffic, if you're waiting in the doctor's office for a while before they see you, your blood pressure is very labile, and this will affect the number dramatically, can affect the number dramatically. So before your doctor goes and diagnoses you with hypertension, you want to get multiple readings just to confirm that it's not just a bad day, all right? You do want to make sure that it does get followed up, though. I get patients that come through and their blood pressure is like 155, 160, and I'm looking at them saying, well, you got high blood pressure. I checked it here in the center 3 weeks in a row. It's always running high. The patient say, oh, the doctor says, oh, I'm just a little nervous around the doctor. Or I've just got a little bit of white coat hypertension. Doctors make me nervous. That could very well be the case, but you really want to confirm that. One of the better ways to confirm that is that you can have a blood pressure monitor that you use at home yourself. Right? So you can check it at home yourself as long as it's certified by the Canadian Hypertension Society, and a lot of the home units are now. Check your blood pressure at home. And if you're at the comfort of your living room and you're still getting numbers of 160, I mean, that's a little high. Some doctors will also do what's called an ambulatory blood pressure monitor. So they'll put a blood pressure monitor on you hooked up to a machine, and you'll wear it for 24 hours. And they'll program it to check your blood pressure every 1 hour, 2 hours, 4 hours, and then they'll get a nice average feeling as well. But if you have blood pressure above 140/90, you really want to make sure that you do something about it. We're big on lifestyle here, so some of the lifestyle things you can do is just restrict your sodium. Be very careful with your sodium. I know our dietitians have got some wonderful education on sodium online, so feel free to look at that. Alcohol is associated with hypertension, so if you're drinking a fair bit of alcohol, that's something you could look to do. Carrying excess weight is associated with some higher blood pressure. So if you're carrying excess weight, changing your lifestyle and your dietary patterns, exercising to try and get some weight down is associated with a little bit of a lower blood pressure. Cigarette smoke, so if you're still smoking, cut back on smokes, that will help with it. A diet high in all those healthy vegetables that the dietitians are always pushing, that can help as well. And of course, exercise. Exercise is a good way to lower your blood pressure. But if you've done all these lifestyle things and your blood pressure is still a little bit high, you really want to make sure you talk to the doctor and say, this crazy guy, Rob, was telling me it shouldn't be any higher than 140/90. I'm frequently above that. What can we do to get it under control? There's 5 different classes of medications that we can use to help control your blood pressure. So make sure you get it checked. For diabetics out there, we're a little bit more aggressive with our blood pressure guidelines. I said for regular people, non-diabetics, 140/90 is kind of the upper limit. For diabetics, it's lower. It's 130/80 is really, you want to be below that as a diabetic. And the thinking is diabetes causes a lot of damage to tissues throughout the entire body. If your tissues are a little bit more fragile, it makes sense that you want your blood pressure to be a little bit lower as well. That's what we found. With diabetics, they tend to do better if their blood pressure is a little bit lower. So that's a little bit high blood pressure. I'm going to spend the last 2-3 minutes here of our cardio talking about the other side of the coin, low blood pressure. This is one of my favorite questions that I always, I like to get asked. And people will come in and they'll say, hey, Rob, you talk about high numbers. Well, when is a blood pressure too low? And I always smile and I say, well, 0/0. And then we chuckle and we joke. But there's no hard number for where our blood pressure is too low. It really comes down to how you feel. The lower your blood pressure goes, the more likely you are to develop symptoms. Lethargy, like fatigue, dizziness. You get up, you're dizzy, and it takes a while, like minutes for it to go away. Passing out. Those are some of the more common signs of a low blood pressure. But what number does that happen at? Well, it varies person to person. I'm going to stop right here just so we can get our exercising heart rate. So keep moving left to right. Find your pulse either in your wrist or at your neck. And I'm going to give you a 10-second pulse check, starting in 3, 2, 1, go. And stop. All right, so let's start our cool down. I want everybody to keep moving, whatever activity you were doing, whether it's marching or whether it's side to side, just start doing that a little bit slower than you were. So I was saying about low blood pressure, if it gets too low, it can cause symptoms, fatigue, dizziness, passing out if it gets really, really bad. But different people can tolerate different blood pressures. I work with a group of patients on Monday afternoons, and they frequently have blood pressures of like 90/65, or sometimes 85/60. And they can actually do pretty good with that. If I had a blood pressure of 90/60, I'd be snoring under the table. I would not be able to tolerate that. For me, my blood pressure needs to be a little bit higher, or I get really symptomatic. So if someone comes up to me and says, hey, Rob, my blood pressure is like 95/70, that's horrible. Well, hang on a second. Not necessarily. If I ask you how you're feeling and you say, I feel like $1,000,000, I don't get dizzy, I've got all the energy in the world, I exercise like crazy, it's great. Well, then 95 over 65 for you is fine. If somebody else comes up and says, oh, Rob, the blood pressure is too low, it's 100 over 70, and they say, I'm tired, I'm dizzy all the time, well, then for that person, 100 might be too low, but for the other guy with 95, that might be okay. So don't focus on the number, focus on how you feel. The lower a number you can tolerate, the better it is for your heart, actually. So that's something to keep in mind. Okay, so we've done our workout, we've done our cool down, we've gotten our heart rates. Let's move into our resistance training. I think today is lunge day for our quads. So we always do one leg exercise and then one upper body exercise. So for our lunges, what we're going to do is we're going to hold on to something that's got some good balance. I always use the phrase, I'm going to use the counter today. And what I'm going to do is I'm going to step forwards, stand up nice and straight and tall, look forward, and then I'm just going to lower my front knee over top of my foot. And we'll see how that looks. So I'm going to be going down. 1. We're going to do 10 repetitions. 2, 3. And the farther down you go, the harder this is, of course, right? So if you find this is a really tough exercise, and it can be, don't go down as far. Maybe just go down 1/4 of the way, or maybe even don't have your legs as far apart, a little closer together. 6, 7, 8, 9, one more, and 10. That's great. Now we're going to switch. And let's see if I can do this with a chair, just to give you guys a little bit more of an idea in terms of what this looks like. So one leg out in front, one leg behind you, and then we're just bringing our knee to the ground. 2. A lot of people always feel bad about having to hold on to something for balance, thinking that that ruins the exercise. That can't be further from the truth. This is a strength exercise. It's not meant to be a balance exercise. If you don't have good balance, by all means, grab something. All right, use some extra support so that you can focus on the strength part of this exercise, because that's what we're trying to do. I think that's 9. And I'm going to say that's 10. Okay, so those are our leg exercises for today, our step lunges. And then we're going to do our upper body exercise. I think for this one, we're going to use a counter. Let's do some tricep dips. This is one that my colleague Renee and I showed a little while ago. And it works the back of the arms. If you've got a chair with arms, you can try sitting in the chair and just pushing yourself up. I don't have a chair with arms in my kitchen, so I'm going to do this using a counter. And all I'm going to do is I'm just going to have my bum to the counter, I'm going to have my hands on the counter, and I'm just going to lower myself down a little bit. 1, 2, 3. I'm looking to stay up nice and tall. 4. I don't want my arms to bend more than 90 degrees, otherwise I'll hurt my shoulders. 6. Making sure I breathe. 7, 8, 9, and 10. And that works our triceps, the back of the arms. It's the opposite of the bicep curl that we often do. All right, so let's finish off with our stretches. We'll stretch those triceps we just worked. So arm in front of your body, and then pull it across your chest. Make sure you're breathing comfortably. And I like to keep moving. I find I get a little woozy if I don't. So moving is good. And we hold the stretch for maybe 15 seconds, just to the point where you feel a little bit of a pull. This shouldn't be causing any pain. Okay, let's do the other arm out in front of you, across your chest. Breathing comfortably. Okay, good. All right, now we'll stretch our chest. So hands behind your back, if you can reach. If not, as close as you can get. And then you're pulling your shoulders back and looking up at the roof. And you should feel a pull through your chest. And likewise, it's still a good idea to move here. Some people, when they look up, once again, makes them a little woozy. So just keep moving. All right. Let's do a runner stretch for our calves. So up against the counter or the wall. You can use the wall too if it's there. Both feet flat on the ground, both feet pointing straight forward, and you'll feel the pull in the calf of the back leg. Making sure to breathe. Okay, and then let's switch legs. All righty. And then let's finish off with our hamstring stretch. Grab your chair. Don't sit all the way back, sit on the edge. One leg should be in front of you and straight, the other leg bent, and then just reaching forward as comfortably as you can. Don't forget to breathe. All right, and then let's switch to the other leg. All right, folks, we are done. So you're going to shake that off. With all the humidity we've had of late, it's really important to make sure that you do hydrate throughout the day. When there's a lot of humidity and moisture in the air, we tend to sweat an awful lot more. And as we sweat, we lose that fluid from our blood volume. Your blood gets thick and pasty, and that's not a good thing. So do stay hydrated. And let's just take a look real quick at our questions, see if there's anything that's popped up there. So the comment that we have about blood pressure, my blood pressure after exercise is lower than normal. Is that normal? Well, yes, it is. So there's something that's called post-exercise hypotension. And it's actually a really, really cool thing. And if you imagine, if you're doing some exercise, like the marching that we just did here, I said at the start, we need to send extra blood supply to our legs, just because that's where we need the oxygen-rich blood. So those blood vessels will start to dilate. That's how we get more oxygen-rich blood to them. And you can imagine what's going to happen to the pressure in an artery when it starts getting bigger like this. You can see it's going to drop down. So typically what happens is when you start exercising, your blood pressure will creep up a little bit. That's a normal, healthy response. And then afterwards, it'll drop down to the pre-exercise, the resting value, and a lot of the time it'll dip down below it. And it has to do with the blood vessels being bigger. And this post-exercise hypotension can sometimes last for a few hours. keeping in mind that's a good thing, right? That's what we want. We like a low blood pressure as long as it doesn't cause any symptoms. So to answer your question, yes, that's a normal thing. See if that's another question or the same one. That's the same question. Perfect. So no other questions on there. All right, folks, so that is our session for today. I will be back on Thursday. If there's anything in particular that you guys would like to talk about, please let me know. I'm going to leave this session up and recording for a little bit. So feel free to type that in the chat or the Q&A box, and I'll try and address your questions on Thursday. Our session tomorrow is being given by Fatim and Veronica, and they're talking about nutritional approaches to manage your blood sugar. So for anybody who's diabetic, this is a good session to talk about. And for all those people that are a touch diabetic or you have a little bit of blood sugar, this would also be a really good session for you guys to tune into. All right, so that's happening tomorrow on Wednesday, June 24th. All right, and now I think I am done. All right, so once again, folks, take care of yourselves, and I'll see you on Thursday. Bye now.